Good evening, Facebook Live, and welcome to another episode of our Point of View Talk Show. How is everyone doing out there? So glad you could join us. Well, we have a lot to talk about today. But before we get started, I'm going to go ahead and introduce my host. We have with us Mike Shealy. What's up, Mike?
Big Mike.
What's going on, everybody? What's going on?
Are you on the beach somewhere?
Hey, man, we're ducked off, just trying to stay away from all this commotion going on out there.
And then we have Eric with us. Hey, Captain, how are you?
I'm doing wonderful. I'm doing wonderful. Can't complain.
That's good. Derek, we have our state representative, Derek Jackson from District 64. I always like to say that. It's like saying your government name. The whole title. How are you doing, Derek?
Good evening, everyone. It has been a very busy day. I'm sure we're going to get into it.
Oh, we're going to get all the way up into it. Well, let's go ahead and introduce our guests for this evening. We brought back Dr. Kay Stevens and registered nurse Midi Bardinelli. And we're going to talk to them, and we're going to update the show that we had before about them, because Dr. Kay did not take the coronavirus vaccine, but Midi did. So that's what we're going to jump into and we're going to talk about. So we're going to go ahead and start with Midi. Midi, how are you doing?
I am alive and well, and I have tested positive for COVID. As of Monday night, yesterday was when I got the results, even after taking the vaccine on December 23rd. So about almost 2 weeks post my first dose. I'm here. I have a little bit of a cough, lots of fatigue, and diminished senses of taste and smell. So I haven't lost it, but I'm noticing now that it's a little bit more diminished after I tried to eat a couple of things that I know are a little more spicy intentionally. But other than that, I'm here. I'm quarantining right now away from my husband and son. I am about 5 blocks from all the mayhem downtown DC. So I'm sequestered in a hotel room. But other than that, I'm here. So I'm great. Thank you for the share.
Yeah. Well, we have a lot of questions for you.
Yes, I'm ready.
Okay. Now, the fact that you tested positive, can you still go ahead and take your second dose as scheduled?
Correct. So today is actually my 14th day. It's been actually exactly 2 weeks today from when I took the first vaccine, and you're supposed to do it 21 days. So I was scheduled this coming Monday for my second dose, and I'm sure Dr. Kay can add and help me with the explanation. So I have spoken to a virologist as well as a infectious disease physician, and he did advise that I do take the vaccine, provided that I'm well and my symptoms aren't, bad in the next week, that I should go ahead and take that second dose. And I did get confirmation with some of the study information, and because I'm not the first person this has happened to, obviously, since COVID, but the fact that I did have the vaccine probably is why I don't think this is my best look ever, but why I'm feeling and looking as good as I am at the moment, because I did have that first dose. So a lot of people were texting me, calling me today, as you can imagine, thinking that I got COVID because of the vaccine, but I had to remind them that the vaccine did not have any COVID derivative in it, unlike the flu shot.
Okay. So you said you're scheduled to take it in another week or so.
So I was scheduled for this coming Monday, the 11th, but it's going to have to be rescheduled depending upon how I feel after I have 5 more days. I'll be in quarantine at least until Monday. And so after then we will follow up. And I can share that I did decide to sign up for a study where tomorrow I'll be getting a blood plasma transfusion, so I can participate to see if those transfusions can help expedite developing antibodies.
Okay. Wow.
So Midi, so thank you for sharing it, and we're definitely keeping you lifted up, my sister. I remember
Representative Jackson.
Yeah, we got to keep you around. We got to keep you around. We keep you lifted up.
That's right.
I recall though they were depending on back in my military days, if we had like a cold or something abnormal going on in our body, they the doctors in the Navy will delay a particular shot. Depending on, if we're going to certain parts in foreign lands where we may need to get something to deal with yellow fever or, there's just a host of other situations out there where we needed to get a shot. But if we had something abnormal going on in our body, that would delay us 7 to 10 days. So is your scenario similar because you have been tested positive for COVID? And I don't even want to get into the different strands because now that's the latest topic. I'm sure Dr. K can break that down as well as you. But is there a certain window where your body has to be, quote unquote, in this normal range in order for you to get your booster shot? Because the booster shot is where they say where the possibility of having some of the side effects. Are you in that window? If so, what is that description of that window?
So what I've been told, and Dr. K can obviously help me with this, as you alluded to, is that they're still finding all of this out, right? So don't forget that the vaccine was just released. It is still not approved. It has been released on emergency authorization. And so even those of us that are getting the vaccination right now, this has not been something that has been proven that it has had the formal approval. So the understanding that right there, because I said that, they don't know, quite frankly. And so that's why you have to make sure you speak with a lot of the virologists, people like Dr. K who are working in this field, and also the infectious disease physicians. And so the advice that they are given is, again, the reason why I'm probably still here to talk tonight and still feeling enough to do so is because I did have the vaccine and it has subsided some of the symptoms. So my symptoms aren't as bad, doesn't require hospitalization as of today. Praise God. I'm not requiring any supplemental oxygen. I'm an otherwise healthy individual with no comorbidity. So I have to also add that as well. So I don't have diabetes, kidney disease. I'm not obese or anything to that nature. So all those things for me personally play into my favor. What has been again suggested is finish my quarantine, and if I am feeling well, that I can still go ahead and take the vaccine and just reschedule it to what you just said within the next 7 or so days after I have been finished my quarantine, even though it might be a few days outside of the initial window of the 21 days when they ask you to take the vaccine after the first dose. And I'll actually ask Dr. K to add on to it, but people need to understand that that's why there's two doses that you have to take. The first dose allows your body to start creating the antibodies, the proteins to start to develop. And then the second dose is kind of almost like a booster shot, which will, because that's why right now I'm only about 50% to 60% efficacy of being vaccinated, which is from the first dose. The second dose is what gets you to that 95% of immunity, if you will, or expected immunity. And so that's where I am. So yes, I am taking the second dose. There is no hard science. And I'll see if Dr. K wants to kind of add anything to that with the work that she does.
Yeah, so I as for those who are just tuning in for this show and didn't watch last week's, well, not last week's, but the previous show, I sat in on both calls, FDA calls for Pfizer and for Moderna. And this happened during the trial. So there were participants in the trial that actually received the vaccine that actually got COVID. Mm-hmm. So what they did is exactly sort of like what media is doing now. They quarantined and they waited for them to get well and test negative. And then that's when they were allowed to get the second dose, because what happens is when you get the first dose, there's no immediate antibodies. And I think some people kind of think that once you get like the first dose of the vaccine, you're immediately vaccinated. And that's not the case. It takes 2 weeks after getting the first dose to actually build some antibodies to COVID. And then after that 2 weeks, if you are exposed to COVID, and that's the other thing that I really want to stress to people, because I have so many people that have reached out and was like, so when am I able to get the vaccine because I'm tired of wearing a mask? and
Right.
you know, and all that. And I'm like,
You still gonna have
no,
to.
the vaccine is not a cure.
Hmm.
What the vaccine does is prevents you from getting the severe symptoms that would cause you to be hospitalized so that our hospital systems aren't overwhelmed like they are now. So that is the purpose of the vaccine. So the same thing with the flu shot. Because COVID is, and we do have the variant strains. Moderna on the call with Moderna, even when they applied for their EUA, there were 5 strains of concern that they mentioned that they were concerned about. So just please keep in mind that these vaccines are not a cure. And the same thing with the flu vaccine. The flu mutates every year. So when you get a flu shot, you get the previous year's strain. So the point of the flu vaccine is not that you won't get the flu, because people complain like I took the flu shot and I still got the flu. Well, yeah, you're gonna get the flu because it's not a cure. Because the virus mutates every year. So they're only giving you a version of the previous year's strain in hopes that if you are exposed to this year's strain and it does retain some of the previous year's genetic signature, that you won't have the extreme symptoms to where you're hospitalized. And that's what people need to know. So with COVID vaccine, the second dose, and Meaty, I pray that you don't have like the COVID symptoms, because that's where Pfizer and Moderna say most people have the COVID-like symptoms once they receive the second dose. And so the second dose is where they're actually like, or as you guys are calling it, the booster dose. But that's the part that's actually giving you more parts of the protein to boost your immune response up to 95%, which is why you are having more of those COVID-like symptoms. And they said, both Pfizer and Moderna said on their calls, that once you get that second dose, you're gonna be so sick that you have to take at least a day off. And the symptoms last up to 72 hours.
So Dr. K, let me ask you a
not
question.
symptoms, reactions, because they explicitly said they're reactions. So they last 72 hours.
Okay, so Dr. K, I'd like to ask you a question. So are both of the shots the same identical shot, or is one a booster? One is an actual booster, or, you have the first shot, what's the second shot?
So yeah, both shots so Moderna, it's the same, which is why they're having issues with some of the states that have decided to not follow the federal guidelines and include, people outside of the plan with giving them the first dose, because the second dose has to come from the same set that they have. Because they're like, oh, we have, vaccine left over. No, you don't have vaccine left over. That's for your second round for the people when it's time for their second shots.
Right.
So it's the same shot, same medication in both of them?
Yes.
Okay.
Yeah.
Okay.
So Dr. K, so let me ask you this then. So let's say Meaty, turns out well, she gets her booster shot, right? Now, will her body create the antibodies? Because they say the best weapon are the antibodies from those who, have had the COVID, tested positive, went through this process, and then their body created these antibodies. But then it gets into the whole, blood type and all that kind of stuff. Well above my head. But what about the antibodies? Can a healthy woman like Meaty, antibodies also help this process in our society as well?
So yes. So once Meaty gets her second shot, when she's good and well, woohoo! And if she decides to donate her plasma, and that has been something that happened earlier in the pandemic, where there were COVID survivors that had mild symptoms that were actually able to donate their plasma to help those who were in ICU or what have you to recover. But it wasn't, they're still testing it, but for the most part, at least 75% of the people that actually received the plasma transfusions actually survived.
Because they say that's the best case scenarios are the antibodies. Is that
Yes.
true, or
Yes,
we
yes.
still don't know?
If you
And what I
build,
can share, Representative Jackson, that's in a clinical setting. That's what we did very early on, as Dr. Kay was alluding to. So I remember back in April, May, when they were trying to figure out therapeutically how to care for these patients, because at this point, nobody was cured. Even to today, we're not being cured. We're just treating symptoms. And so one of the things what we did was what she just said, and what I'm going to participate in tomorrow is I will get a blood plasma transfusion, hopefully then boosting my antibodies. And then what I will do is once I am recovered and then antibodies develop, because antibodies take time. So even though I have COVID today, I may not have enough antibodies yet to really do anything to anyone else. But by next month, I can then go back, donate my plasma, and then prayerfully none of you all get it. But if you do, hey, I have COVID, let me go get this blood plasma transfusion, and that can reduce you from having those signs, those symptoms. Just as Jacqueline mentioned, one of her friends, family members passed away yesterday.
Mhm.
As I was at the hospital when I found out that my test came back positive. A friend of mine's father had just died yesterday morning of COVID. And
Wow.
so it could have been a scenario where as soon as you're diagnosed, and if you meet certain criteria, you know, age, comorbidities, lung status, et cetera, they can hopefully transfuse you sooner than later. So maybe you can get transfused as soon as you're diagnosed. So by the time you get to day 6 or 7, you won't feel bad.
So you can get the transfusion, but you can't get the vaccine if you have COVID. Is that what it is?
Well, I've actually vaccinated myself personally over 50 people. What we have done, because of Dr. K's point, that they're trying to get the people who don't have it yet. The theory, not the theory, well, it is the theory. The rationale is if you already have COVID, in theory, hopefully you won't get it again. And hopefully you've already went through the process and your body's already developing antibodies to protect you against getting COVID again. So we asked the question, there's 3 questions that we ask. A, have you had any low grade temperature or fever in the last 24, 48 hours? B, have you had any reaction to any IM medications or vaccines in the past? And then the last question we asked when I was giving vaccines myself was, have you tested positive for COVID in the last 90 days? And if the answer was yes, we did not give you the vaccine, we would then ask you to wait, because let's get the people who haven't had COVID so that way they don't get it. So why am I going to, like right now, I already have my dose, I get it, but you wouldn't want to vaccinate me now because in theory, my body is starting to produce antibodies. Let me go ahead and give it to Representative Jackson. He's out there in the public doing whatever it is that he's doing, campaigning, etc. He needs to get it so we can protect him. I already have it. So that's the rationale of not getting it if you had it before.
Oh, wow. Okay.
Exactly. It's a lot.
It's a lot. Yeah.
Very, very overwhelming. And if I could be very honest, the worst thing of all of this, honestly, isn't just the COVID. It's figuring out how to live and go somewhere without being around anyone for 14 days. I'm in a hotel room. I'm blessed because I have an organization that is paying for where I am, you know, for these days up to the 14 days. They're paying for my parking and everything. Everyone doesn't have that luxury. And and then I'm also, but I don't have any room service. I have to figure out ways to have food delivered to me and I mean room service, meaning they're not coming in to clean the room. So I have to make sure my towels and stuff are changed whenever somebody can come by to do that for me. And then I have to have all of my meals delivered, you know, via friends, you know, Uber Eats or whatever it is, because you're literally in a room. And what I will say, if nothing else, to give a little bit of humor, it's not funny, but to give some humor considering the time that we're living in, I will never, ever go to jail. Let me just tell you that right now. I have been in this room by myself and I have amenities, right? I have a TV, I have you guys, I have the internet, I have my cell phone, and it is absolutely driving me crazy. And Representative Jackson can ask our mutual friend who I love so much, will tell you this is not who I am, to be sitting in any room for 5 days, like with nothing to do. So I have a bed, my bathroom, and listen, this is, and I'm joking, but it is hard. So you got to figure out, how do I navigate these waters? How do I get food? How do I get water? You know, how do I get my clothes washed? How do I get an extra set of clothes? What do I do? How am I going to get
Right.
and fro? How do I, luckily I'm married, so my husband can take care of my son. Luckily, they're already home. So it is very difficult. So I empathize with those other individuals who don't have places to go and they're quarantining, in an apartment that might be with 2 or 3 people, or you have a condo,
Right.
or you don't have the funds or the means to get Uber Eats dropped off to you, or people that have cars that can do that for you. So it is, it's given me a different approach and a different appreciation for COVID, that even the messaging that I've been sharing in the past from months ago to even now, self-quarantining is not an easy process, period.
Yeah.
Not easy.
And
I'm absolutely, utterly blessed to be in a hotel room paid for by my hospital, that everybody doesn't have that option.
Right.
and that's,
Edie, let
that's
me ask
one-
you a question. I'm sorry.
and I was going to say that was one of the things during the start of the pandemic that I was stressing to the Black community. Is start thinking about your COVID plan. So if you are positive and you live in a multi-generational home where you cannot spare a bedroom or a bathroom, you need to figure out where you can go or start putting money aside. And when we had here in Georgia, when we had the outbreak in Hall County, and that was from the Hispanic community that would work, that they were in the chicken plant, and they could not self-quarantine because we went, there were like 14 people in one household,
Right.
and it was just spreading like wildfire.
And it's
Mhm.
real. It's
Mhm.
real. And I
Yes.
think I told you guys, I'm blessed. My husband just texted me right before we started. I don't know if I said this already, but I'm grateful that they both tested negative. And so, because my plan was, God, if they test positive, then I'm just going to go home and we can just all be miserable together.
Yeah.
But now I'm just going to be here. But that is real. So for people like you, Representative Jackson, and others, think about how the communities that you serve, as Dr. K just said, if you do have that chicken plant, what are they going to do? Where are you going to, how can you help serve those individuals? So this has given me a whole nother light. And as these strands are coming, and as I've lived through this, the last, 24 hours now, it really humbled me. I mean, I do have means. I am able to get a hotel even if I had to on my own. But
Right.
any of us on this TV, I'm sure, knows if you buy a hotel in DC for a week, that's easily over $1,000, right? I mean, same for you guys down in Georgia, unless you're going to, Motel 6 or something, you're not going to the Marriott Marquis in Atlanta is going to cost you $1,000 to be there for 14 days. So
Right.
we have to think about that. And you're talking about food service and all of that. So quarantining is a lot. So the financial impact of quarantine, I mean, again, a whole nother conversation.
Right.
So, Midi, or what type of medications are you taking, or are you just letting it run its course?
I am letting it run its course tomorrow. However, I'm blessed, obviously, working in the medical field. I do have someone dropping me off some zinc. I just took my own dose of vitamin D, actually. I don't mind sharing. I am already vitamin D deficient. So I take 50,000 units every week. That's the only medicine that I take besides a multivitamin. And so, but I was advised to get some vitamin C and zinc. And so I'm going to get that as well. But other than
Okay.
that, I don't take any other medications.
Okay.
So again, it's so important for people to know there is nothing to take for COVID. There's no antibiotic. There's no, it's not like you have some infection. And quite frankly, that's not just COVID, any virus. And Dr.
Right.
can speak to that. So that's why people also have to be careful when you get the cold and flu. Oh, give me the Z-Pack. Well, those things only work if you have a bacterial infection. If you have a virus, there is no cure for that virus.
Right.
So you're only managing symptoms. And so even with the vaccine is managing those symptoms. It is not curing you from the virus. And you're only hoping that 90 to 95% efficacy, that those protein binders, I mean, if you can see my hands, you're hoping that these, if you're using this as a model, you're hoping that enough of these are blocked, but these are still open. So you're hoping that enough of this is blocked. So when COVID starts floating around, I'm able to block it, but COVID can still connect here. That's where you have that additional 5%. So you're
Right.
hoping your body's going to block it here before you get to this connection. If it gets to these receptor sites, then you still have COVID.
Meaty, let me ask you this.
Sure.
How's your husband? And this is certainly a part to remember, the family impact of this. How is your husband and your son dealing with mom being away for an extended period of time, just, so that you can get through this? Because I know just like you miss them, they miss you.
So Captain, it's funny that you said that, and we laugh, but it's for real. Luckily I have a really good united, family unit. But when I first called my husband, he literally said, I'm not gonna lie, he said, let me call you back. And he literally,
Wow.
Okay, I'll call you back. And he literally hung up the phone and then called me back about 60 seconds later and said, so let me understand, so you have COVID. And even though I'm a nurse, even though I'm a healthcare professional, even though, he's heard all the many messages I've been sharing, his initial thought was, are you okay? That's it. He initially thought, like, are you going to die? Like, literally. He wanted to make sure that I wasn't going to die, that I wasn't going to need to be in a hospital, that I didn't need to be on a ventilator. As I shared with you guys, just had people recently, I have a friend right now still on a ventilator fighting for his life here in DC.
Wow.
And so when he heard that, it was kind of shocked. My son, 14 years old, was already nervous in the beginning of the pandemic when none of us knew what was going on. And, mommy, are you okay? Are you sure? Can I get you anything? Like, no, what are you going to do? You're 14. What are you going to do for me? Just love me. And so, we prayed, and I got my N95. I had a regular mask on, got the N95. I did stuff at work, sprayed my office down with Lysol, spoke to my manager so she could cover for me while I was away, who works for me. And my nurses were there when I walked. They said, oh my God, I can't believe this, air hugs. I got home, literally Lysoled my shoes, stripped out the door, and ran upstairs and grabbed some tights and a couple t-shirts, my toiletries, put it in a bag, and made it downtown DC to a hotel. And so it's been a little stressful, but I will say I can't imagine those people again. My husband is not an abusive person, so I'm grateful that I'm not worried about my son being abused. I'm not an abused wife, so I'm grateful that he was not upset or angry. And so those are real things that we also have to think about,
Yeah.
in addition to, as Dr. K said, in addition to the financial impact of quarantining. But again, I'm blessed. I'm absolutely 150% blessed with my scenario, and having my mental faculties, not having, we're all a little bit crazy, right? But not having any diagnosed, mental issues.
Sure.
It's still stressful. Like, I have anxiety, like I'm stressed, a little depressed. Like I said, I'm happy to talk to you guys. I can probably talk to you all day because I'm talking to nobody in this room by myself. So again, when you really think about what that totality of this means, it's a lot. So I'm on definitely the good end of all this.
Okay, well, we have a question.
So Meaty and Dr. K, real question. This past week, another pharmaceutical company, I want to say Johnson & Johnson, but I could be wrong. Their vaccination shot, you only get one, but the efficacy is only like 70%. It's not in the 90 percentile as Moderna and Pfizer. Will that create the same kind of scenario for someone, Dr. K, for someone like Meaty, very healthy, African-American, because some of them saying, well, man, if it's 70% efficacy, at least I don't have to take this shot once versus twice, although the one that you take twice, the one like Meaty took, is in the 90 percentile, because now that also is creating another conundrum. People are starting to pick and choose and say, well, maybe I get the Johnson & Johnson version versus Moderna. Can you share with our audience, as other pharmaceutical companies are rolling their vaccination shot, what are some pros and cons of 70% efficacy versus 90% in one shot versus two?
So yes, so there are actually 5 other vaccines in production. They are not mRNA based. I will say that they're all viral vectors, and 2 of them are use the viral protein subunit. And when speaking to AstraZeneca, which is up for, I think they'll probably go, what we received information, February for their EUA authorization, but they are 2 doses. And even with 2 doses, they're only 70% efficacy. But they're cheaper to produce because they can be refrigerated. So a lot of the other vaccines that are coming on the market, and just to throw that out there, they are thinking about countries that can't afford the Pfizer or the Moderna. So let's just put that on the table. The Johnson & Johnson so the Johnson & Johnson vaccine is a single dose vaccine, and it has low efficacy, around 40-50%, which will be the same with, so even with the Pfizer and Moderna vaccines, like they didn't have to, because that question was asked. Like when we looked at the numbers and we looked at the charts, where after 2 weeks, the placebo group and the vaccine group kind of split off after 2 weeks as far as the protection. So you can, if someone, because there were people in the studies for both Pfizer and Moderna that chose not to get the second dose. So they will have that 50% protection, because the first shot gives you 50% protection, and then the second shot is what boosts you up to 95%. So essentially, Johnson & Johnson is saying, well, we're just going to give you 1 shot and charge you to give you this price point, and then you will only have this amount of efficacy, if you will.
Okay, well, we have a question from one of our Facebook viewers. The question is, are all of the panel or any of the panel members going to get the vaccination shot?
I am, I have, and I will be getting my second dose.
Okay. Dr. K?
I am not.
Captain Jackson?
No, I'm just kidding. No, I'm not. No, I'm not at this point in time. No.
Yeah, not right now.
Okay. Mike Shealy?
No, honestly, I'm not. I'm just going to work on just like really working on distancing myself from people, like just trying to stay,
and wearing your
isolated.
mask.
Yeah.
Mike,
So you're going,
but I will say, Mike, is don't work on it. You absolutely have to. I'm a witness, and I just want to put that out there. Like, I'm a witness. I'm a nurse, and I have to go to work, and I always wear my mask. So I'm just letting you know, don't work on it, bro. You have to, or else you will be in a hotel room calling me.
yeah, because he definitely won't be here. He will be in a hotel room somewhere. Won't be here. Sorry.
You can't stay here.
Has to go. But I don't have any plans right now of taking it either. You know. But Dr. K, can you explain how soon it will be offered to the general public? You know, because people may think that they can, go up to CVS and get the vaccination like they do the COVID test.
Well, Jacqueline, they're starting that already here in DC. Actually, as of next week, for those individuals that are 65 and older, you can go ahead and start pre-registering at the local. I don't know if you guys have Safeways down. I forgot if you guys have Safeway in Georgia. I know you guys have Piggly Wiggly and Winn-Dixie, but up here we have Safeways and Giant, and they are starting to partner. The FDA and CDC are partnering with some of those third-party pharmacy companies to allow people to start get vaccinated here already.
So yeah, so the recommended CDC or federal phase for vaccination was the healthcare workers first, then essential workers, then those with high-risk medical conditions, and then adults 65 and over. And but some states like Texas and Florida said, well, we're not going to follow the federal guidelines. We're going to give it to whoever we want to. And so it just depends on your state. But for the most part, if following the CDC or the federal guidelines for distribution of the vaccine, just to make sure that those healthcare workers and those in long-term care facilities who got the first dose will have enough available to receive their second dose. That's why that particular model was put into place. However, I don't know if you guys are keeping up with it and keeping up with the vaccines in the news. There's already a shortage.
Mhm.
So the general public, if you're relatively healthy, you probably, just based on the doses that we have, and I think Pfizer plans like to do like 1 billion. And then you also have to realize with Pfizer and Moderna, they're not just distributing vaccines here, they're distributing it in other countries as well. So when we see these numbers that they produce X number amount, that's not just here for the US. So keep that in mind. But realistically, the general public, like if you're not in that 65 or older or like the high risk group, it would probably be towards the end of the summer, early fall, if we have enough doses. And Walgreens and CVS are the two main drugstore pharmacies that have been selected to work with the state public health departments to distribute vaccines to the public.
Now, what about for children? Is it going to be available for children?
No, they're not. So vaccine for children has not been developed yet. They are actually working on it. Pfizer pulled a trick play at the end of their EUA authorization call, because they initially was asking for EUA authorization for 18 and above. They dropped it down to 16 because towards the end of their study, they enrolled like 167 16 and 17-year-olds. So they dropped it down. So the vaccine for children won't be ready for some time because they're not high risk. They are carriers. They've been shown to have high viral loads, but as far as getting sick, they're not really a priority right now.
You know what? I have a question for both you, Dr. K, and for Meaty. You know, what do you think? What kind of job do you think those two drug companies are doing to help make things a little bit more easier for even individuals like myself, who perhaps, for right now, it's worth noting, not taking the shots right now, but it's not to say that may not happen later on in the future. But for those who really have reservations about this, what type of job do you think they're doing in terms of informing the public and reassuring them that this is really truly the way to go? Because there's still a lot of hesitancy out there. You know, folks are doing trick plays and they're redrawing it's like they're redrawing the starting lines. I mean, what's your assessment on just how that's being carried out? Because again, the people, you know, they're risking their health based on how these shots are given and who they're going to, and, you know, raising the bar for some and lowering it for others. It's just a question.
So if I may, and this is Meaty Barnelli, what I would first say to that, and please hear my heart on this, you have to approach your health as a consumer, period. You cannot assume that, it's their responsibility to share everything. What I will say, none of us on this panel has the expertise that Dr. K has, because she specifically studied virology, microbiology. I mean, I've had those classes, but she has a PhD in that. I don't.
Right.
So none of us can speak to that type of information. I don't know how to fight fires and know there's a science behind fighting fires. I do know that you don't just douse water on a grease fire, right? You have a specific expertise. However, I work in a hospital. I have to know the basics of pass, pull, aim, squeeze, and sweep, right? I know that. You should be proud. Aren't you proud of me?
Very much so.
So I know how
Very
to
much
do that
so.
and how to extinguish and use the fire extinguisher if I ever need to. You go to the base of the fire. I use those analogies to simply state is that all of us and in our health, you have to be a consumer. Stop assuming it is my job, just because I'm the nurse, to give you all the information. because we
Okay.
have to stop having blind trust. My
Okay.
personal opinion is that if you want to know about any of the vaccines, all the information is public. It's public knowledge. So it's there. If you choose to be like Dr. K and read the 500-page document and read and understand what it means to go through a trial, qualitative analysis, quantitative analysis, you can do that. It is not their responsibility. They have already said to us it's safe because the FDA has said that it's safe to a certain extent, right? And so you have to then rely on your physician, your medical providers to help guide you in making the best decision for yourself. So in my opinion, they have done all that they can to share the information because we do have the wonderful internet and all the information. It has to be public knowledge. The EUAs are published. You can get on these calls. The problem is it's up to your local, the things that you're talking about who gets a vaccine, when did they get it? That's all man-made and it's based on your local Department of Health. It's how your Department of Health is rolling out this process. DC, the first doses that DC received when I first shared this with you guys, the week right before Christmas, the District of Columbia has over 700,000 residents. We received 6,800 doses. I work at a hospital that has over 3,000 nurses. And so how they decide how that is broken up, you can't blame Pfizer, you can't blame Moderna because they're not responsible for distribution. And so that's where people also get the hesitancy, the uncertainty, the mistrust, the misguided information because they feel that somebody is holding it from them. And it's not the actual pharmaceutical company. That comes from however the information is being shared to you guys. So that's my personal opinion. And I'll see if Dr. K wants to add to any of that.
Yes, media is correct. So once both pharmaceutical companies received their EUAs, it was left up to the states, like the state public health departments. But the crazy thing is the state public health departments are still fighting COVID and the hospitals are still trying to manage beds. Right. So, I mean, realistically, there's no one from a federal perspective that's overseeing the vaccine distributions, how it's going out. So once you get the first dose of the vaccine, you are enrolled in a 2-year study and the CDC is tracking you. They'll send you like a survey or whatever and, ask you how you're doing or what have you. But as far as like, are you the next person to get this? Or when will, the average person be able to go to their local drugstore, pharmacy to be vaccinated? That information has not been detailed. And it's, there's no one that's over like a vaccine task force even from the White House perspective. It's just not there. There's no oversight.
Definitely not today.
Yeah,
Well,
right.
So with you bringing that up, how do you think that riot is going to affect the rates of the virus that's going out? Like,
I can tell you right now, it's gonna skyrocket. If you look at any of the pictures today,
because you have to add that to the holiday break. So now they have two different like it's gonna get crazy out here.
And you have people that have brought their particular strains from wherever they've driven or flown in from to the district.
Okay.
Yeah.
I mean,
it's a super spreader event. And,
Yes,
it's interesting. It's interesting that you raised this topic from a political standpoint, because this morning I was on a panel. I was the only Democrat. There was 2 other elected officials. One was a state senator, Republican, and a Republican House representative. And so the 3 of us were on this panel. I was the only one, Meaty, wearing a mask. The only one wearing a mask, right? But I gave them the business though. I went into the juggler. I went for the juggler because they were saying how the administration, both the federal and the state, did a phenomenal job giving this glowing report. So I was the 3rd person to speak, and I was like, I looked at the audience. They had about maybe 60, 65 people there. I'm like, that's all a lie. we have over 10,000 deaths in Georgia, over
Yes.
380,000 in the United States. We have another strand. You got a situation in California where they literally have to decide, right? We're forcing doctors and nurses and physician assistants in a situation that we're asking them to do something that we never really fathomed doing, right? And I said the conundrum is we still have to deal with pregnancies, we still have heart attacks, we still have broken elbows, cut behinds. I mean, so I said, I looked at my colleagues, I looked at the audience. I said, you can't talk about economic development or budget or anything else until we get this pandemic under control.
Yeah.
Right.
And our
If you don't get this pandemic under control, you don't have to worry about restaurants being open. You don't have to worry about transportation. You don't have to worry about all these other things in a normal situation. And so my question to you, Meaty, and Dr. K, and I know I have my own hypothesis, but I would love to hear you all's thought, that what if we had a federal and state strategy, national strategy? We understand to make sure that how we manage beds and, staffing, doctors, nurses, PAs, and resources, right? PPEs and things of that nature. And so when you think about what the federal government could have done, sign a defense act to say, we're going to pay whatever, Pfizer, Moderna, you name it, and we want you to maximize, and better yet, instead of Johnson & Johnson, Merck, instead of you all creating your version of the vaccination, we're gonna say you all going to share the same formula. So we want everybody to have 94, 95 efficacy instead of 40, 50, 70, etc. Right? And we want a federal strategy. We're going to figure out the sourcing. We're going to figure out the logistics, and because there's this number that everybody's been floating around, that in order for us to really curtail and get this right in our society, that we need to have 75% of the population vaccinated, right? Mm-hmm. It's the same thing that we had to deal with smallpox, mumps, measles, right? So vaccination shots is nothing new. Lord knows I had my fair share over 2 decades in the Navy. So I would love to get you all, as healthcare practitioners, there's some blame here. We still to this day do not have a federal approach, strategy to curtail or mitigate this pandemic.
The short answer to that is common sense isn't so common. Captain Jackson can tell you, even from within his role, when everybody's in charge, no one's in charge. And so he can't decide when and how to go fight the fighter if I'm opening up a door and Dr. K's opening up a window and we're missing and messing up the oxygenation that helps to fuel the fire. Someone has to be in charge to say, we are going to do this so the whole building doesn't get destroyed. And you basically gave the answer in your question, is that because we had a lack of that, which we did not have, to President Obama's credit, when Ebola took place, there was a national strategy of, listen, we're shutting this stuff down. If you went to any of these countries, this is what you need to do. Everything needs to be filtered and funneled. Any of those tests had to go down to Georgia, to you guys, to the headquarters for the CDC. This is what we're going to do. Every single hospital needs to prepare at least 2 rooms if you happen to get a positive patient or a suspected patient of Ebola. And this is the quarantine process for those patients and how you care for them. My personal opinion, and as you were speaking, I looked it up. Today, 3,541 people died today. well, probably from yesterday to today, according to the CDC.gov website, 3,541. We are now at 356,005 deaths. We now received 227,692. I'm now in that number because this was in the last 24 hours of positive cases. 200,000 cases in the last 24 hours. 200,000 cases in the last 24 hours. I got to say that again. 200,000 freaking cases. So we're now already at 20 million. And by the grace of God, I'm here and I'm healthy and I'm able to speak. So because we had a lack of unified governance regarding this process, everyone was able to do his or her own thing, which is what Dr. K was saying. You get to do Pfizer, you do Moderna, you do this, you do that. There was no kind of unified approach. And none of us were oblivious or blind when I don't want to hear from my politician, just like I don't want to hear Dr. Jackson, Representative Jackson talk to me about how to care for myself, because that's not what you do. You're not a nurse. You're not the virologist. That's why you have me and Dr. K on to talk about that, because I'm the healthcare professional. She's a scientist. You let the experts speak to that. And so our president, did not allow Dr. Fauci, whether you like him or not, and I forgot the other woman's name, actually for them to speak. And even though you may not like them, we're in the middle of a pandemic. And so where are they? Let them be the messengers to carry the appropriate message, to speak to and answer the questions, to allow them to have guidance. And so because we did not do that, a house divided is a house that will fall. And we literally have fallen today, literally and figuratively have fallen as what we're seeing, because we have not had any guidance. And now, to your point, we are now putting all of our politicians, luckily, Representative Jackson, you're still down in Georgia, but all of these people were just inside the rotunda today. That stuff has to be cleaned. It has to be wiped down. And the hospitals, Dr. K, I'll shut up and let her speak. Even in this hotel room, I literally Lysol down every single thing when I came in here. The handlebars, the telephone. I Lysol the pillow that I put my head on. In the hospital, we're wiping down everything because I'm positive. These people are all in. I'm looking at the TV behind me. They're all in with all of our government leaders. That place needs to be like fumigated.
Right.
They need to go in there and clean, because the particles, Dr. K, are still floating in the air.
Yeah.
And we don't know what they've done or because I don't even know how I got it. That's why I was telling my brother down there, wear that N95, bruh. If you're not going to get the vaccine, that's cool. Don't hang around people without an N95. That is my new lesson, because I still to this day, as careful as I've been, how did I get this? So yeah, you answered your own question, Representative Jackson.
So I just to jump in there. So I actually was a part of President Obama's Global Health Securities Initiative. I worked on Ebola before it was a household name. I learned from the swine flu outbreak or pandemic, because people think this is the first pandemic. The swine flu was a pandemic. And so, but unfortunately, the current administration dismantled all of that. I was traveling to developing countries, setting up disease surveillance systems to prevent something like this from happening. I spent time in villages sleeping in one-person tents under that Global Health Securities Initiative under the Obama administration. And so, but what we're facing now is, and what people aren't talking about, is a testing issue. You may see all of these testing sites with people lined up, but what's really not being talked about is all of those test kits and all of these labs that have popped up during this pandemic didn't exist before now. A lot of those tests that are being used have EUA authorizations. They're not FDA approved. No one's talking about that. So we're getting a lot of false negatives because they have repurposed those testing kits for COVID without proper data. So I'll just go ahead and put that out there. If you have had a COVID test, look at your results. It will tell you this is not an FDA approved test if you received one of those. And I tell people all the time, and they were like, well, this is saying I'm positive. I don't have symptoms. I said, look on your test results. What does it say? And I said, go get tested again by your doctor, because most of the time the doctor's offices had the FDA approved kits. The doctor's like, no, you're negative. So That's one issue.
Ask you really quick while you're speaking on that. I think you should elaborate more, because I've even told people, you know, I've had friends, hey, I'm just going to go get tested. I'm like, well, if I were you, call your doctor's office. And my test was done at my hospital, obviously. And
Yeah.
so that's what I said. Don't just, unless it's like your Department of Health site that you're going to, don't just go to these random 24-hour
Pop-up sites.
pop-up clinics, because you know you got to get that information. So actually it's interesting hearing you say that, because I didn't
Yeah.
even realize that myself as a nurse, because obviously I
Yeah.
have access to a medical center, so that's where I go. But that's so important to share that information.
Yeah. So, and then the other thing, Representative Jackson, that I would like to talk about is the turnaround time for these tests. We can't get a test result in 2 or 3 days, or sometimes 7 days, because by that time you've infected dozens of people. And now with this new strain that is more infectious. And so back in the summer, we did have a strain that's similar to the one that the UK has. And I've been looking at some of the data, and they do have some similar genetic components. So it may be just the strain that we saw in the summer when our numbers skyrocketed. People from the UK came here because they flattened their curve, and then they started traveling again. And so they came to the US and they picked it up, and then they took it back, and it mutated based on their region. And so that's where we are. Because I always tell people, the more you try to kill a virus, the more it fights to stay alive. So it's going to mutate. It's just like the flu. That's why you have to get the flu shot every year. It's going to continue to mutate because it's in survival mode. And so that's the thing. We have to get ahead. Not just like so much emphasis was put on the vaccine, but not enough emphasis was put on having proper tests, and tests that you can get a result in a day. That's not that
power.
Yeah.
We need to really have, I can share with you guys. I took my test, Dr. K, yesterday, Monday around 2 or 3, when I checked the system, because I had the accessibility to do so. I looked, the result actually came back that night. Well, guess what? I had went home. I'm sorry, my result came back around 9 something that night. Nobody called me. So I went to work. I had 3 or 4 meetings yesterday throughout the hospital. I was around people. And then something, I was like, oh, let me just check the system myself. I probably would not have gotten called until today, because we didn't have the manpower to finally follow up. And only because I'm a nursing director and I have the wherewithal and ability to do so, I logged on myself within my hospital system, not the portal, because it still hadn't popped up on the portal. So I logged into our hospital system to get my own information. And that's how I found out that I was positive. And and it was 5 or almost 4 or 5 o'clock yesterday when I found out, and I'm like, oh my God, what do I do? So guess what? I could have gone home. Well, I did go home, but I mean, I could have gone home. I could have kissed my husband in the mouth again. I could have kissed my son. I could have, you know what I mean? I could have done any number of those things.
Yeah.
And we're here. And the doctor finally only called me because he goes, oh, we heard that you called. Yeah. And he said, but to the point, he's like, they're overwhelmed.
No.
And we are in Washington, D.C. So think about those other areas. And D.C. has 1 million doctors. We have a lot of them. But think about those other areas in the country that don't have enough physicians or NPs or physician assistants or nurse practitioners to make all these calls. So this public health crisis is also amplified with the lack of human resources to do the work to make all these follow-up calls that needs to be done.
Wow. Well, you know what, guys, we're going to wrap up this segment of our point of view so we can get to the next part, which is the election results here in Georgia. But our prayers are definitely with you, you know, and keep us informed. Let us know what's going on. We're going to bring you guys back, because I want to find out what's going on once you get your shot. You know, we want to follow you as well to find out how you're doing.
I would love to do that and love to share. I'm getting, like I said, the plasma tomorrow. So I'll probably in another 2 or 3 weeks, I can share. Representative Jackson, thank you so much. Captain Jackson, thank you so much. Ms. Jacqueline, I appreciate you all. Coming live to you from downtown DC. I have a lot for you guys to talk about.
Well, Media, if you want to stick with us, you and Dr. Kev, y'all want to stick with us, and while we talk about the election results and everything that's going on in Washington, you are more than welcome. The
Sure.
ham.
I'm ready. I'm listening. I'll chime in. I'm the mother of a black son.
Because you're right there. You're right there in it. So you know
I'm
what?
5 blocks from where all this is happening. I'm on 13th and Massachusetts Avenue right now.
Wow.
Something. So first we're going to talk
Well,
about
we sent two brand new U.S. senators up there to help this situation.
Yes, sir.
Yes.
Yes, sir.
All right. That's awesome. That's awesome. We made history. We made history.
Yes.
That's so awesome. Yeah. So Darren, tell us what's going on. I mean, how are they feeling? You know, because we got, Jon Ossoff and what do we call him now? Do we call him Senator Reverend Raphael Warnock or Senator? I mean, what do we call him now?
The man.
Well, we can start off just calling him. There goes that alpha. You like that meeting? I know y'all like that. I know you like that.
Boy,
here's the benefit. So both Reverend Warnock and Jon Ossoff are senator-elect. The beautiful thing is, because Georgia made history, right? We made history. And sending these two United States senators from Georgia up there, it is now 50-50. So the tie,
Yes, sir.
the tie is always going to be broken by a sister.
There you go. Say it.
Right?
That's right. Say it.
Okay. Right?
HU.
Go by the name of Kamala. Madam Vice President.
Right. Madam
Okay.
Vice President.
Yeah. So, so that's it. Shout out to all the HU. Now I know there's several HUs. I know there's several HUs. I get it.
I went to Georgia Military College, so
I get it. But it ain't nothing like the real HU.
I know. Harvard
unit.
No.
Oh,
Harvard.
Oh.
Wait, Harvard.
No.
Absolutely not.
No.
Expect us this way.
Not here. Not around here, right, Meaty? No, not around here.
Dr. K, I'm speaking. Speaking.
Yes, go.
Representative Jackson, I'm speaking.
Our Howard sister.
I'm just saying.
That's right. Listen, ain't nothing but
speaking.
Yeah.
Absolutely. But see, not only will that help Georgia, it helps the United States because Mitch McConnell is all about gridlock, right?
Yeah.
I mean, during a pandemic, and I appreciate how Meaty and Dr. K break down this pandemic from a healthcare professional perspective. But as a policymaker, as a lawmaker, we control the resources. We're talking about dollars to be able to help, doctors and nurses and PAs and epidemiologists to combat this coronavirus. And then we can also help families, right? We can help families, here, in 2017, they gave the top 1% a tax cut in the amount of $1.2 trillion, but yet Mitch McConnell says $600 is good enough. Kelly Loeffler says $600 is good enough. I'm sorry. We said $2,000, and even $2,000 if you're living in D.C. is not enough, right? I mean, so we're clearly seeing the difference between the two parties. And so by us having two United States senators from Georgia make it 50-50, Kamala Harris will be the deciding vote every time. And we know that where her heart is. Her campaign was launched from we the people, right? She's coming from we the people perspective. And so when you look at Ossoff winning by 24,000 votes, Reverend Warnock won by 62,000 votes. And unfortunately, there was another good brother on there, Daniel Blackman. He lost by 60,000 votes. And this is the reason why. This goes back to educating the voters how important it is. Don't skip from person to person. You got to go down the line. I tell folks all the time, right? You can't say, well, I like the quarterback, but I don't like the receiver. Your team's going to lose.
Right.
Right? And so because Daniel Blackman did not win his race, Georgia is in the top 5 of 50 states, top 5, and paying the highest utilities. 18% of your net income, not gross, your net income is paid towards your utility bill, right? That's incredulous when you start talking about dealing with a pandemic and determining if you need to keep the lights on, right? And Meady broke down very eloquently about how your lifestyle can change if you end up positive with the coronavirus, right? And so we're talking about how to help those keep money in their pocketbooks and their wallets. And in a time like this, where you got an administration, because nobody talked about debts and deficit, right, in the last 4 years, right? This guy been golfing 312 days.
That's right.
Right?
That's
People
right.
are dying. Meady broke down the numbers. She broke down the numbers. And while people are dying, he's golfing.
He's out golfing.
Representative Jackson, I have a question for you, and maybe you can help me. How we understand how important elections are, and you are an elected official, but a lot of times people don't appreciate how you, Representative Jackson, can impact the lives of the Georgians, honestly, more so than the actual president. What can we do? I don't think people understand how the constituency can get involved and help to hold you accountable to those type of things, because people don't understand what that means. And so a lot of times they skip those midterms, they skip the representative elections, they skip the governor elections, because a lot of times we only think about the mayor, or you only think about like the big elections. How have you, as a leader over the last several years of doing what you're doing, how can you share an example of when one of your constituents or a group of constituency has held you accountable to help them do something? That's what I want to know.
Yeah, no, that's an excellent question. And listen, for the audience, I did not pay her to ask me that question.
You did it.
Right?
No, full disclosure, you did.
That's an excellent question. No, here's because you're right. Because we always say politics are local. So the closer the level of government is to you, that means the faster we can impact you, right? So your mayor can impact you faster than I can. I can impact you faster than the president, right, at the state level, right? Mm-hmm. And so to your question, Meady, the other reason why that question is so invaluable is because can you reach out and talk to your elected official, right? You can talk to your mayor. You can talk to your city council, right? You can talk to your state representatives, right? But what happens at the federal level is very, very hard and difficult to touch base with them, right? You have layers and layers of staff between you and your federal level. It's not their fault. It's just the way the system is built. And so it's important, ladies and gentlemen, when you think about how important it is for you to vote not every 4 years, every 2 years. The midterm is so important. We got President Obama, to answer your question, Meady, we got President Obama in office in 2008. The Tea Party came in 2010. We didn't show up. So the Tea Party got most of their candidates elected, which put a kibosh on President Obama's agenda. Yep. So when people say, well, President Obama didn't do anything for black and brown people, well, we did not show back up in 2010. So the things he talked about in 2007, he got elected in 2008. When he started putting everything in place in 2009, the Tea Party came in 2010 and put a stop to everything. So the only thing he effectively was able to do was the Affordable Care Act, affectionately known as Obamacare. So out of his 8 years, the remaining 6 years was all executive orders. why executive orders are the most horrible way to try to bring law and legislation, because when that president leaves, those executive orders go out the window.
Yeah.
So that's the reason why your vote matters. That's the reason why it's important for federal, state, local, county, city. It's important. Every time that ballot box is open, you need to go and vote. And let me tell you, voting have consequences, because if we would have showed back up in 2010, like we showed back up in 2012, because we realized, we're like, wait a minute, what happened? And so 2010 woke us up, and then we came back out and we got him back in there again. But unfortunately, it didn't precipitate down, because a lot of our black and brown bronze brothers and sisters only voted on the top of the ticket, and you didn't go all the way down the line. And that's the same thing that happened to Daniel Blackman. There was only 3 names on the ballot.
It was only 3.
And we were telling everybody, Ossoff, Warnock, and Blackman.
Yeah.
And because Blackman did not get elected, our utility going to continue to go up.
I didn't get any text for Blackman.
I didn't see any commercials.
They didn't call me about Blackman.
You didn't get any phone calls for Blackman.
But they texted me. I was like, my
I
phone
didn't
was
get
on
any
fire.
mail from Blackman.
And you know what, Jack? I saw a report that some people thought that they thought the Blackman was an emoji, and the name Blackman, they thought they were saying black man, and that it went along with Warnock and Ossoff. So they just thought it's all black man. So Ossoff, Warnock, black man. So it wasn't black man, but black man, close enough. And so people didn't really delve into it anymore. They almost took it at face value, and it's like, okay, because I'm like you, I'm like, it's all on the same page. How can you
on the same page
stop it?
But that's part B to Meaty's question. We have to educate and build awareness around everybody that's on the ballot. That's how we hold folks accountable, right? There should be no reason why, you have someone for 6 years never conduct a town hall. David Perdue never conducted a town hall. So how can you come back 6 years later and expect for your constituency to vote for you if they haven't heard from you in 6 years?
But
nobody on this panel will keep somebody employed if they didn't produce for you in 6 years.
But let me say this, the problem, and thank you, God, for dropping it in my spirit. Black and brown people don't have the luxury, in my opinion, to focus on things such as our political representatives as much, in my opinion, because so many of us, I mean, probably outside of those of us on this panel, but the average person, we are still focusing on the basic needs of survival. And so the luxury to start thinking about, oh, I have time to go to this town hall. Oh, let me just go ahead and write a letter to Representative Jackson. I got to go to work. I don't have, even though the trash was picked up today in my backyard, guess what? I know I have his number on, like, I personally know my council member. Like I'm friends with his wife, just like I have Representative Jackson's number. So for all of the people that represent you, they may not have your cell phone number. Call Meaty, I'll give you Derek's number. I'm just joking. Don't do that. But what I'm saying is that I have the ability, because of the space and place of which I'm in, because of my level of education, because of my ability to navigate those waters, I know how to access you. I know how to get that. I'm not going to say no. But the average person who doesn't have that ability to do so, who doesn't have a PhD in epidemiology or viral, I'm sorry, Dr. K, whatever the PhD is in, who doesn't have that information to know that, they're just trying to get work to get to Walmart to get to their job. And there's nothing wrong with working at Walmart. I'm just saying you don't have that luxury. Just like I will leave my job and go to my son's school to attend the PTA meeting because I have a job where I can leave my job to go check up on my son, where so many people don't. And I think that is also part of the problem, that we are not at that level and have the ability and luxury to even think about or understand what you do or what you don't do. Town halls, even the fact that you're just a person of your word and that you are having town halls, you have 50 million things on Facebook, you have people and opportunities for people to ask you questions live and get a real answer from you directly. The average person does not have an hour and a half to spend on Facebook like we are tonight to have this dialogue, because they might be working 2 jobs because they're so essential. That's
Right.
all.
Yeah, no, you listen, Meanie,
And that's a problem.
you're exactly right.
People, just like when then the president, I'm here in DC, spoke so negatively of the congressman in Baltimore about how bad that city was, and oh, his district is so horrible and they're drug infested. Well, he did the best he can, but people were not going to pour money into a neighborhood. But guess what they're doing now? They are. It's called gentrification. They let it get
Yeah.
so bad. They wait till it gets so poor, so the rent and the buildings are so dirt cheap where they can go up and buy everything. And then now all of a sudden it's such a wonderful area. Dr. K can tell you they did that right here in DC. U Street was not the place to be when she and I first came to college in the 90s. Now you go to U Street in Washington, DC, which was the epitome of all the black jazz music and all of that back in the 50s and 60s. Now you can't afford to buy any house down on U Street as $1 million plus. Any apartment is going to cost you at minimum $3,000 to $4,000 a month.
Yeah.
So those people.
Okay, guys.
No, listen,
let's talk a little bit. Let's talk about. I'm sorry, State Representative, but let's talk a little bit about what's going on at the Capitol. Let's try to get that in a little bit, because that's something big that's been going on all day long. So let's just like touch bases with that, because basically what they were doing, they were counting the Electoral College votes. They got to Arizona
and shut it down.
And shut it all the way down. I mean, it went crazy.
With the letter A.
Yeah, but they just on A. They didn't even get through the rest of the alphabet.
Right, but keep in mind, Jacqueline, so today was strictly ceremonial.
Right.
Okay. All 50 states certified the Electoral College last month, right? December 14th, 15th, something like that, right? All 50 states, right? So the Electoral College was certified. So simply today, we've been doing this for a very long time, even well before I got elected. Today was simply the vice president will come in. You got joint chambers. Basically, you got the Senate and the House of Representatives in one chamber. And they simply read off all 50 states to certify, to basically announce to the world and to all the citizens of the United States what was certified already. So there's absolutely nothing Vice President Pence could have done to give Trump 4 more years in the presidency. Nothing, zero, nada. The Constitution doesn't. There is strictly ceremonial. That's it.
And they've been saying
to inform the public and inform the world who is going to be the president of the United States.
They have reconvened just now. They're showing if you're all they are back in chambers and they're reconvening.
Right. So what they did, so part B to your question, Jacqueline, so out of the 50 states, these 13 senators and 140 House of Representatives, they identified 6 states that they were going to object. The very first one was Arizona, right? Yep. And so they got Georgia on the line, they got Michigan, they got Pennsylvania, right? And so these 6 states out of 50 is their strategy. And you can't pick and choose that way. The Electoral College is 535. You need 270 to win. So even if Georgia said, hey, Trump, here's 16 Electoral College, that only gives them 232. The math still doesn't work. And so they've identified these 6 states to contest.
And so that's why all the protesting was going on?
Because no, that was something completely separate. No, Trump texts to the Proud Boys and all these white nationalists, hey, come have a wild rally. Stand by, because we're going to do our thing on January 6th. Their whole goal was to have this protest rally to save America and disrupt the process.
Mm.
And they tried. They tried.
And they tried.
Yeah.
Because they don't, I mean, you have to know the Constitution. And I mean, it's clear that that same person that was leading them doesn't know. And he was still saying that he basically won and he could still, you know, be in office and just sending out those incendiary remarks that would not allow them to like really understand that there's nothing that they could do by being there other than get ID'd for jail. So maybe he was just looking for friends for when he's locked up. I don't know.
Yeah. Because he basically incited a riot. That's what
Yeah.
he did.
He
So that's a
did.
criminal
He
offense.
did.
You know, and hopefully they're gonna
Someone
do-
died today, Jacqueline. Someone died. A woman
That's-
died.
got
Trump
shot in
is
the neck.
responsible for that.
Yep.
He should be held
Incited.
accountable for it. He should be held
Yeah,
accountable.
he
for it.
incited this. He should be held accountable. In
Yeah, but
fact,
what's gonna happen?
I tweeted out Vice President Pence and the cabinet members need to implement the 25th Amendment. They need to go ahead and impeach him.
Impeach him.
Put him
Yeah.
aside, 'cause he's not well. He's not. I'm not a doctor. I'm not diagnosing. Meaty, Dr. K. But he something ain't well up there.
So impeach him again?
Immediately.
Yeah. He was acquitted the first time, but no, he needs to be impeached. There's a problem. There's a problem. You know.
No. He wasn't acquitted. No. He's
No.
impeached now. The House.
No, it's pretty. Okay.
Okay, let me clear that up.
Yeah, please.
Donald Trump has an asterisk. He is impeached. The House found him guilty. He's impeached. The Senate
What?
did not remove him. So it's a two-step process, right? So Richard Nixon knew he was about to become impeached. Richard Nixon said, you know what, I'm going to go ahead and resign
I'm
and
out.
not even get this asterisk by my name.
Right.
Bill Clinton was impeached, but he was not removed. So Bill Clinton has an asterisk by his name as an impeached president by the House. He was found guilty of those charges, but the Senate did not complete that process and did not remove him. But Donald Trump is impeached. He
Okay.
just wasn't removed.
Okay. Well, he'll be removed on January the 20th.
That's
Hopefully,
correct.
And they're gonna make it, but they're gonna make it difficult and challenging along the way.
Yeah.
Unfortunately.
Yeah.
Unfortunately, this is the same guy during his inauguration from Washington, D.C., talked about carnage. We're like, whoa. This is where his mind was from the very beginning.
Yeah.
He should have been evaluated then when he was talking about this doom and gloom on your inauguration. Who wrote that speech? Talking about carnage, right?
Yeah.
He is who we thought he was.
Mm. Wow. Absolutely amazing.
So hopefully they'll get through everything tonight since they've already reconvened and everything. Hopefully they'll get through the other states and we can.
Well, so it's 6 states, it's 2 hours of debate. So they're going to be up all night.
That's per state?
2 hours. Mm-hmm.
And he's still encouraging them after today, after all that we've seen for the last several hours, he's still encouraging them to say, hey, look, still protest. Don't go down without a fight. What's that? What's the mantra for the United Negro College Fund? A mind is a terrible
thing to wait.
You know, what I will just say to all of this, as a 45-year-old woman, I consider myself still somewhat young, but this really has been just a humbling experience to watch today, to be a person that did cast my ballot as part of the Electoral College, and to see this unfold and just to really honestly see our democracy on its knees today is very disheartening. And my question, my open question, not to just the panel, but just in general, is there has to be people like you, Representative Jackson, and others, that we have to have a plan moving forward. Black and brown people, we need to have one unified leader. You know, back in the day, you know, our parents, you know, whether, you know, people are pro or against, at least we had an MLK. I know that we have the Black Lives Matter movement. I know that we have people like Shaun King. I know we have all these other people like Killer Mike. You know, I know we have all these people out there that are doing it, but I really do feel that we need unified leadership, no different than what you asked Dr. K and I about the pandemic, because there's so many, it's multifaceted about how this is impacting Black and brown people. Because for me, health always comes first. Because if you're not here, if you're not healthy to do anything, you can't do anything else. It doesn't matter. So you have to look at people and have accessibility to healthcare. Then you have education. Then you have the economics. Because if you're not educated, then you're not going to be able to get a good job. So for me, all this just really I fear for my 14-year-old son, and those of you, you know, that have kids, like, you know, younger children, this next generation, what are we leaving them? And we need to have a plan of action, particularly after the debacle that we saw today. I mean, talk about never imagining a pandemic. I mean, I would have never imagined we were going to see this. I knew there was some craziness, but people literally breaking down wall and glasses and doors, I could not have imagined that. I definitely knew protests and stuff like that, but they didn't mess up the city of DC. They literally went to the White House, like they went to the Capitol, and that's scary to me. So we need plans of action for, you know, however long you're going to be in office, however long you decide to run again, however long you decide to be in public service, of some type of template that could be at least passed on to the next, whoever the next is. But we need someone right now to really stand up and lead us, literally.
Yeah.
Well, no, today was a sad day. The day was a sad day for democracy. And I agree. I mean, I was on social media all day today, in meetings and phone calls. It was just a sad day.
Yeah, and the world was laughing at us. Everybody, they were laughing at us. We really looked crazy. We looked crazy out there, you know. But hey, we're gonna get it together. We're gonna really get it together. But guys, we are gonna have to wrap this up. But
What?
we're going to wrap it up. We're getting together here. But I want to thank Dr. K and Meedy. I mean, we wish you the best. You know, let us know what's going on with you and everything. We really thank you so much for joining us. And tomorrow we're going to be doing our OPOB Up Close and Personal. We're going to have author Nisha Taylor. She wrote the book Love, Lust, and Lies. So join us tomorrow at 5:30 p.m. for our one-on-one. But remember, guys, everything you heard and everything we said was our point of view. We'll see you next time. Thank you for joining us.
See you, Dr. K. Thank
Bye,
you.
guys.
Thank you,
Mike,
guys.
Jack.